Health Service is developing its academic standard throughout the UK, and the first degree is expected of all qualified nursing staff. What we're seeing is that staff who want to go up the ladder in the Health Service are expected to get a higher award than that. So a postgraduate diploma would allow them to go up the hierarchy in the organisation quicker.
What I really like about the nursing course is that it's split between classes and placements. So just the same amount of time that I've spent in class, I've spent actually out in the community.
When I finished university, I worked in an inpatient acute organic unit, so people with dementia care, and it kind of shaped me for the role that I'm in now as a dementia specialist nurse at the Royal Bournemouth Hospital.
We work very closely with Dorset Healthcare University NHS Trust, who are our local mental health provider and have university status.
My role is to make sure that nursing students have the appropriate learning environments to go to.
So we work with the university to allocate placements. We try and make sure that everybody has a range of placement. It's not necessarily allocated to their year of study or experience. We just try and make sure that they see a whole range of experiences.
I liaise quite closely with the academic advisors, the university practice learning advisors, also known as UPLAs, and the student placement officers as well.
I remember being told that I was going to be working on in an inpatient ward for addictions, and I was not up for it at all, and I didn't really know what to expect, and I went in not thinking it would be for me, but by the end of it, actually, it changed my opinion massively, and I went into this knowing that I wanted to be a dementia nurse, but by the end of it was thinking that this could be a role for me.
Students, when they initially come to Southern Health, they're invited to an induction day where we provide them with all the contacts that they can expect within Southern Health. When they're on placements, all the teams within Southern Health are aware of the practice educator and our roles, so they will have our numbers and names.
We want students that come to us on placement to want to work for us as a trust.
Just because of where all the placements are the places that I'm going to be looking for a job in. So if I impress while I'm on placement, then managers and team leaders will remember me.
To ensure that the placements are of the best quality, we conduct regular audits of the learning environment. We also take into account reports from areas like the Care Quality Commission, and also take into account students' feedback on those placement areas.
We also work with a number of charitable organisations, primarily Dorset Mental Health Forum, who provide peer specialists to support learning within the university.
All the work that we do is based around the principles of co-production, so really valuing what everybody brings to it. And as students at Bournemouth University, you have a real opportunity to explore co-production in a way that I'm not aware of happens anywhere else in the country.
Students will undertake theory units, which are a mix of classroom learning. That could be lectures, it could be seminars, it could be small group work, with some online resources which are readily accessible through the online platform. Students also undertake sessions in the skills lab. Some of them relate to fundamental nursing skills, and obviously physical care is an important element of the mental health nurse's role.
Things have progressed so far within the last 5 to 10 years in mental health nursing, and things are beginning to really shift with equality with both mental health and physical health care.
It is challenging. You're going to be challenged academically and personally, but ultimately it's very, very rewarding.
Become a nurse, it's the best thing I ever did, and I'd never change it, never.